Hello, everyone. My name is Dr. Yonit Arthur, and you are on The Steady Coach. Today, it is my great privilege to bring you this interview with Dr. John Stracks. Dr. Stracks is a board certified integrative physician and family physician. And he also happens to be one of the world's leading physicians who works with people with medically unexplained chronic symptoms, such as chronic pain and, yes, of course, chronic dizziness. In this interview, we talk about Dr. Strack's background. We talk about his experiences with people suffering from dizziness specifically and their road to recovery. We talk about what recovery even means or what it looks like. And we talk about some of the advocacy you can do for yourself as a patient who may or may not still be working with physicians in the conventional field, and of course, where some of those relationships can affect recovery. I hope you enjoy this interview as much as I enjoyed speaking to Dr. Stracks. And of course, if you enjoy this interview, please like it, please share, please subscribe to my channel. And I'm looking forward to your questions and comments below. Please enjoy. All right, Dr. Stracks, thank you so much for joining me today. I greatly appreciate you agreeing to come visit on The Steady Coach.
Happy to be here. Thanks for inviting me.
Well, let's get started by giving everyone a primer on who you are, if that's okay with you. So would you mind sharing a little bit about you, your work, how you got involved in this work to begin with?
Yeah, so I'm Dr. John Stracks. I am here in Chicago and also have the ability at this point to see patients by telehealth, no matter where they are. I have been practicing medicine now for 13 years. I finished my residency training in 2009. I also had my own health issues that got better with mind-body medicine even before I went to medical school. So this was probably almost 25 years ago, and we can talk a little bit about that. And I've recorded podcasts talking about that also. But I got to medical school with the idea that what was going on in our lives would show up in our bodies. And when I got there, I thought, oh, this is great. Like, I'll tell people about it and people's pain will be healed and everybody will be happy. And it took like, I don't know, a nanosecond to realize that wasn't going to be how it worked. And so I had a separate career. I was a social worker for a while before I decided to go back to medicine. And so always thought in more psychological ways. And once I got to medical school, I was in 2001, I did everything that I could to sort of push my career into more integrative fields. And so I did research with a psychologist who was studying the physiology of loneliness, and took every course on health and healing that I could find in medical school. And I started calling Dr. John Sarno in New York City, who did a lot of work on the psychology of back pain, to see if I could come work with him, and eventually did a little bit of work with him as a resident. I chose residency programs that I only applied to places that would let me do some integrative work also. And so spent 4 years at the University of Michigan in Ann Arbor, working in their integrative health clinic there. That's where I met Dr. Howard Schubener, who had just opened up a mind-body medicine program in Detroit. So I spent a lot of time with him during those 4 years that I was in residency, and then moved back to Chicago in 2009 to work in the Integrative Center at Northwestern University in downtown Chicago. And I spent 8 years there, seeing a lot of patients for a lot of chronic issues that weren't getting better in any way. And so my job was to sit with them and explore options that they hadn't thought of already, including paying attention to the psychology and the stress, talking about diet, talking about the use of supplements or alternate practitioners. And my passion has always been the mind-body medicine side. And it was a small piece of what I was doing at Northwestern. And so in 2016, I made the decision to open my own practice to try to do more of that work. So left the hospital in late 2017. I've been running my own center since then. We've added in the past 2 years, a physician's assistant, and 4 psychotherapists, and a physical therapist. And we continue to see a lot of people who aren't getting better using conventional medical means and are looking for different alternatives, including this idea that what's going on in their lives is showing up in their bodies.
Mm. So it sounds like you started this path of being a physician already knowing that you were going to be going down this more integrative road.
Already knowing in my own
Mhm.
body. And so in 1998, this is a long time ago now, I fell down a flight of stairs and seemed to be okay. But then a couple months later, started having strange symptoms that nobody could get a handle on. And I went to see conventional physicians. I went to see alternative physicians. I had tests done, and nobody could get a sense of what was going on. I had a lot of hand and foot symptoms, a lot of numbness and tingling and pain, and I was having trouble typing
And imbalance issues too, I saw.
and balance issues. Yeah.
Mhm. Mhm.
And nobody could sort it out. Like, I didn't know what it was. It became
Mhm.
sort of my whole world, trying to figure out what was going on and how I could get better. And then, after about 9 months of dissension into like being only a patient, I was talking to a friend who had seen Dr. Sarno for his back pain a number of years ago. And I'd always been interested in alternative healing. I had read Dr. Sarno's book. I knew who he was, but I went back and I reread it. I was like, oh, too much going on in my life. I was trying to figure out how to get into medical school. I was dating the woman who is now my wife. And as that relationship was getting more serious, that was overwhelming to me. And just on top of that, I was having a spiritual crisis at the same time. And so too much for me to manage at that point in my life. So it started seeping into my body. Once I recognized that, I actually was able to do some things and get better quite quickly, which was great. And I think a lot of people who end up doing this work professionally have similar experiences, right? A lot of people learn these strategies and then it takes a while still for people to feel better. But some of us had very dramatic, very quick turnarounds. And I think that spurs us on to figure out how to do this work for a living. And so I got to medical school. I'd had this experience. I had done a lot of reading. I had talked to some leaders in the field. And I brought that with me to the practice of medicine from the very beginning and knew that that was the type of medicine I wanted to concentrate in.
Then you're going to be the perfect person to comment on how conventional medical approaches to patients with these types of chronic medically unexplained conditions can set up the trajectory of someone's recovery or lack thereof.
Do we have a few days to talk?
I know. I think that you could go on for 6 hours and people would still be listening. So
it's interesting. I think, I and probably you and a number of people in this field, the way we conceptualize chronic symptoms is that, the medical system would say, if you're not feeling well, then something's wrong in your body, right? It's completely biomedical approach. And so if you're not feeling well and you go see somebody in the conventional medical system, they're going to say like, oh, I can see you don't feel well. And then they're either going to say, I think this is what's wrong and this is what we're going to do about it. So physical therapy or injections or medications or procedures. Or they're going to say, I can't tell what's wrong. Let me try to send you to somebody else who maybe has a better handle on it. Or worst case, I can't see what's wrong. You must be pretending. You must be faking.
Or so anxious. It's just anxiety. Get over it.
Yes. And so those are sort of the options there. But I believe from my research that chronic symptoms frequently are not about damage, nothing wrong in the body, but about the sense of danger. And danger comes from a lot of different places, and I can talk more about that over the course of this conversation. But I say to my patients all the time, there is nothing more dangerous than the medical system.
Mm.
And the kinds of things that practitioners have said to my patients over the years in terms of, it's going to be like this for the rest of your life. It's going to be progressive. You're going to be in a wheelchair. You might be paralyzed. It's never going to get better. It's going to, it's only going to get better if you spend hundreds of thousands of dollars on therapies.
Get used to it. I've had people told, you may as well hire an aide now. It's never going to get better. Just get used to it.
Yep. And so there's really very little out there that creates more of a sense of fear and danger than the medical system does. And so often it just pushes people into the symptoms getting worse rather than better.
Yes. So if it's okay with you, since on my channel, as you know, we talk primarily about chronic dizziness, and people who are familiar with your work or some of the work of your colleagues hear the word pain a lot and wonder if it applies to them. First of all, can we clarify here that when you say chronic medically unexplained conditions, you are indeed including dizziness conditions?
I am indeed including dizziness, and I have treated many, many patients with dizziness.
Okay. So have some of them had some of the common diagnoses: persistent postural perceptual disorder, Malda-de-Barkmont syndrome, vestibular migraine, right? Maybe even post-concussion syndrome.
Patient yesterday, cervicogenic dizziness.
Cervicogenic dizziness, yes. I often forget to name that one, but yep. So that one too, you've seen those. And they can recover using these mind-body methods in
People
your
get
experience.
better. Correct.
Yeah.
People get better using these strategies for sure.
Yes. Okay. So now that we've established that, I'm wondering, in your experience, have you seen, not to say that this occurs only or exclusively for people with vestibular issues. I think people can get danger or fear messages from any physician in our medical system.
Yeah.
But it seems to me, and again, I recognize my bias, that in the vestibular world, there's a particular mystique or a particular, I don't know, you have to go to 10 specialists before you get diagnosed with anything. Do you see this in your patients who show up with dizziness disorders, that they've had a particularly hard time?
Yes. And I'm thinking, I'm here in Chicago. Dr. Hain, I don't know if you know
Yes,
Dr.
very
Hain.
familiar. Yes.
I like Dr. Hain. And he calls himself the dizzy doctor. And so most people in Chicago, if they've had the symptoms long enough, have gone to Dr. Hain and Dr. Sergey's office.
Yes.
And so they've been evaluated there. And I feel like they actually take a pretty nice approach.
They're pretty integrative. Yeah.
To this. And so, the language that I'll use with patients is that the conventional medical system is very good at some things. And so if you have strep throat, you can come into my office, I can look at your throat, I can do a swab, I can get a test, it shows up positive, I can give you a treatment, the treatment always works, you're better in 3 days. Like, it's a perfect system. The only issue is that it works for very little besides strep throat and maybe bladder infections. And so when we're looking to try to treat dizziness and vestibular disorders, what I will frequently say is that the whole process does not map well into the conventional system. If you walk into my office with dizziness, it rarely means you've got this disease or that disease that's easy to name. And so I think that's what happens to patients, is that they go and see practitioners, and the practitioners can see that they are suffering, but they don't have a good framework. There is no great framework in the medical system to say, this is what it is, and this is what you should do. And so we give it various names. And it's interesting to me. So say someone gets diagnosed with vestibular migraine, all of a sudden they're in migraine land. And so now they're using triptans and new medications and medications to try to prevent migraines. And so it provides a playbook, but the playbook doesn't usually, I think, have a whole lot to do with what's going on that's causing the patient's symptoms. And so I think because dizziness and those types of issues don't have easy explanations, then people keep getting passed around from practitioner to practitioner, trying to sort out what's going on, and frequently not having much luck no matter who they see.
Yeah. So like you're saying, not to say that people with certain types of chronic pain conditions don't run through exactly this same rigmarole. People with fibromyalgia, for example, there's
Right.
often no finding at all. But with vestibular issues in particular, there's almost never a finding. And
Right.
there's no herniated disc to blame things on.
Right.
And not to say that that doesn't carry its own type of distress, but especially for people growing up in our system, they're expecting the physician to find something, and when there isn't a finding and they just have to go to doctor after doctor, it
Yeah.
just adds to the fear and stress.
And there may be regional components to it. Here in Chicago, people frequently get diagnosed with crystals in
Oh,
their
yes.
in their
Yes.
ears, and I'm not sold on the whole concept. But like you said, it's the physician and practitioner's attempt to say, like, okay, here's the issue.
Right.
This is what we're going to do about it. But again, it doesn't oftentimes lead to relief.
Right. When it does, then the proof is in the pudding, right? If someone has a physical issue like crystals, BPPV,
Mhm.
a repositioning maneuver will fix the issue. But when someone's on their 10th repositioning maneuver and
Right.
they don't actually have symptoms that are consistent with the crystal, then why are we still persisting in this approach that's not
Right. Or
working?
what I see frequently is that people will get the treatment initially, and the maneuvers will work, but then the symptoms come right back, and then it does not work.
Right. Because as I try to explain here on my channel and to people I speak to, your brain, once it has a template for something like dizziness, like vertigo from BPPV, your nervous system can keep those symptoms going with no physical damage necessary.
Absolutely.
Yeah. Okay. So in that case, I have a feeling I know exactly what you're going to have to say about this one, but we just talked about diagnosis, and we talked about how that process can be so laden with fear for people.
Mhm.
So people are now given this symptom-based diagnosis, and they're, depending on which diagnosis it is, like you're saying, they're in migraine land, or they're in incurable neurologic disease land, which is super fun, or they're in, you have this unexplained vestibular disorder, maybe this will help you. So where are we going wrong with our recommendation to just put someone on a medicine
Mhm.
or send them to CBT or vestibular or physical therapy? Where are we going wrong there? Why is that not helping?
I think it's not helping because it's not getting at the underlying source of the problem. And
Mhm.
so I trained in integrative medicine, and the message that I always got and internalized was that we have medications which should be used as a last resort for
Mhm.
people. And the medical system being what it is, medications frequently are the only resort. And I've had physician colleagues say to me, they say, I don't understand. Like, if I didn't give somebody a prescription, what would I do? Like, there's
Oh.
no recognition anymore in the medical system that we as physicians are supposed to do anything other than write prescriptions, or now make referrals. And so if somebody's dizzy and has that symptom and goes in and say, okay, here, take this antivert that will make you better, that's not what's causing the problem. And
Mhm.
so, not totally, this is a dramatic example, but if somebody had cancer and was feeling nauseous and we said, here, take this medication that will make the nausea go away, we're not
Mhm.
going to do very well by that patient. And
Mhm.
so we did a webinar last year with the Psychophysiological Disorders Association, and I interviewed one long-term patient who's quite active in this world. And his mother had died when he was quite young, 10, 11 years old, somewhere in there. And he developed symptoms of repetitive strain injury, and so a lot of hand numbness and tingling, and had those symptoms from the time he was 18, I think, until he was about 35. And I said to him in the course of the interview, how often in those 17 years that you were looking for answers did anybody ask you about what it was like to have your mother die when you were so young? And he said, never.
Right.
And,
Right.
and another dramatic example of this, Dr. David Clark, who does a lot of this work, is a gastroenterologist who you probably know. He made his career in Portland, Oregon, seeing patients with GI issues who nobody could help make better. And he's got this story that says, somebody sent him a referral for a woman who's having abdominal pain, and it turned out she was in an abusive relationship. And so they got social work involved, and they got her into safety, and the symptoms got much better. And so he wrote the report and sent it back to the referring physician, who then responded by saying, "Oh, it's comforting to know I didn't miss anything."
Oh. I like you, I've been shocked that when I see my clients for the first time, I am the first person to ask, "What was going on in your life when the symptoms started?"
Mhm, mhm.
As though our bodies are completely removed from our lives.
Correct. And what I will say frequently is that it is rare for me to see somebody who's feeling off balance in their body who's not also feeling off balance
Mhm.
in their lives when the symptoms start. And so
Right.
I have recognized that over the years,
Mhm.
that it's fairly rare, not impossible, fairly rare that somebody comes in with dizziness who's not going through some sort of stressful event.
Right, right, and as you say, there are some exceptions, although, on my YouTube channel, frequently I'll have comments, "I'm not stressed. I've never been stressed.
Mhm.
Everything's fine. I don't know why I got this dizziness thing," and I'm like, "I'm amazed. Like, tell me how you managed to have a stress-free life." It
Mhm.
does seem to be a fact of life for many of us.
Yeah.
So, do you have any thoughts on why some people then go on to develop physical symptoms as a response to stress?
I think everybody develops physical symptoms in response to
Mhm.
stress. And so, I say this regularly. And so my patients who are savvy about the mind body medicine world, and they'll ask me periodically, like, gosh, why are we so much more prone to pain than other people are? And so my responses are generally like, let's take a step back. There's, 150 million people in America who are suffering with chronic pain, right? It's not just the handful of people who are coming to see me. Most of those people don't know anything about this. And so they are using medications, having procedures done, and all the rest of it. And as too many people using high dose opioids and having complications
Mhm.
from that. And so it's not that people who recognize what's going on are more prone to pain. They just have a lot better and more effective ways to deal with it. And so
Mhm.
during the height of the pandemic, my patients who understood these concepts would get in touch periodically and say, like, "Oh my gosh, this is so stressful. Can I set up an appointment and talk to you about it?" Whereas my patients who didn't understand this well would call me and say, like, "Gosh, my arm really hurts. Do you have a surgeon who can cut it off for me?"
Yes.
And
Oh,
so knowing about these concepts, it just gives people a chance to get at the symptoms at the root of it. That's the advantage. I don't think that people are any more or less prone to symptoms. Like, everybody responds to what's going on in their lives.
that's such a great observation. There, and this kind of goes back to what we were talking about earlier, this mystique surrounding dizziness and vestibular symptoms. If the first line physician, if a family physician said, "Oh, you're feeling a little dizzy. I just want you to know how normal this is, that this is happening. I know it's scary. That has there been any stress in your life recently?" We see that sometimes bring these on. What percentage of people would just stop right there and be done?
Right.
But that's not happening. It's immediately pathologized. "Oh, you have a symptom. Okay, well now we've got to figure out
Mhm.
which diagnosis may apply. We got to start sending you to specialists." And it's a safetyism, really. I mean, again, it's well-meaning physicians who are doing this.
Absolutely, but it's the way that medicine is taught these days, that if somebody has a symptom, then something must be wrong. And so the same as what I said about physicians not recognizing that they can do anything other than write a prescription, there's no teaching in medical schools at this point that people can be very, very sick and very, very symptomatic, even though there's no physical damage in the
It's
body.
so shocking to me that that's even possible when the biopsychosocial model of medicine has been people publicly laud it. I mean, they always say, "Oh, we know it's all," but they'll put that at kind of the beginning of a research paper. Yeah, we know it's biopsychosocial, but let's just ignore the psychosocial stuff because that stuff's messy. We have to sit down and talk to people. Let's
Right.
look at these biomarkers of disease.
Yeah, and I think that there's a lot of pressure in the medical system for physicians not to do these things. You just hit on one, which is time, right? If you've got 4 minutes to see a patient, it doesn't make sense to ask them what's going on and leading to a conversation that could take 10 minutes. And there's I think because it's not taught particularly well, a lot of physicians don't know what to do with that information, even if they got it. I have written publicly, I get heart palpitations sometimes, and they were pretty bad for a while when I first started practicing medicine for obvious reasons. And so I called a colleague and said, like, hey, I've been noticing this, I should probably get checked out. So I went to her office. She's a delightful friend of mine. I bet I said half a dozen times in the 20 minutes I was with her, I thought it was stress related. And she picked up on that 0 of the times, did not engage in the conversation at all. And so, another one of my friends says that she's older, she's in her 70s, and says that every time she gets sent a intake form for a medical appointment, and she's in her 70s, so she goes fairly often, and she always says that she's feeling suicidal. She's not feeling suicidal, but she always says she's feeling suicidal in the report, and nobody has ever asked her about that. And so it's not great training in how to have these conversations, and then the system isn't set up to have these conversations, and so physicians just don't do it.
Right. And then folks like you and like me, like Dr. Schubiner, like many of our colleagues, we just end up going outside the system.
Right.
We have to make our own
Yeah.
practice outside the system entirely in order to be able to treat people effectively.
Yeah. And like I said, the medical system in the United States is very good at some things. And so, if you and I finish the interview and I go to have lunch and trip and break my arm, I don't want to call you and have you say, like, hey, I think you should just meditate. I want to get somewhere where somebody can evaluate it and treat it. But what we find, I think, is that those situations are much rarer than we've all been led to believe, and much more often meditating for half an hour or having a conversation with you or talking about what's going on in my life is going to be much more effective than getting to a major medical center to evaluate it.
Well, so that, of course, raises a really interesting question. So people who view my channel, they're coming here from all over the world, mostly Western countries where the medical systems are similar to ours, but all over the world. And what can they do for themselves to advocate for themselves in a system like this when they are dealing with a chronic condition like this and they don't have access to me or to you in their country? What can they do?
So, I mean, I think that there's a two-part answer, right? It's things that they can do within the system, things that they can do without the system. And so outside of the system, right, there's a lot of resources. You have a lot of resources that you've put out. I have resources that I've put out talking about these concepts, helping people try to understand where the symptoms are coming from, helping people to try to understand that the issue is the sense of danger, not the possibility of damage. And so there's a lot that people can do on their own. When I first had these symptoms, I was 28 years old, and the landscape was much different then, right? There's Dr. Sarno in New York and Dr. David Schechter, our colleague in Los Angeles, who had just opened his practice. And so I read Dr. Sarno's book, and I contacted Dr. Schechter, and he sent me for $20 a workbook that asked me to journal write every day about things that were going on in my life, and that combination helped me a ton over the next couple of months. So not super complicated, not super in depth, but enough to keep my focus on what was going on in my life and not going on in my body. And that has all that has exploded exponentially over the past 10 to 15 years. I don't know what I can say and what I can't say about various resources that are
I'm It's open, whatever you think would be helpful.
I mean, there's tons, right? There's Dr. Schubiner and his Unlearn Your Pain, and he's going to be doing a little bit of work in our office, and his book that's out there, and his program, and the Psychophysiological Disorders Association has a lot of resources on their website, and the Curable app that I've worked with for a long time, they have a ton of information, and they have groups that people can join. And the AVO app, which is based here in Chicago, they've got a study going on currently that people can get into with no fee at all, and your resources and my website and my blog, and that goes on and on and on at this point. And so there is a wealth of information about how this happens, how we can feel so terribly physically, even though nothing is physically wrong in our bodies, that people can learn those concepts and then start to move forward towards using these strategies and resources to feel better. And so I'd say there's a lot that people can do. I'm part of an email list that I don't know if you're on or not, of a lot of practitioners around the
Add me.
Okay, we'll talk offline and we'll get to the but somebody just messaged this morning through that email list and said, hey, where can I get a copy of Dr. Sarno's book in Korean? And then somebody messaged back and said, here's where it is. And so even when people aren't in English speaking countries, there's still ways that people can tap into
these resources.
Yes, absolutely. And then in terms of being in the medical system, I think that's a little bit harder, right? I mean, we've been talking about how physicians are trained in certain ways, and I don't think it matters so much whether the United States or other countries. And so they've got their ideas about what they need to do, which is write prescriptions and run tests. And so when my patients are trying to figure out like how to get some of this information to physicians, I say a couple of things. One, like physicians are really busy and they just don't have time. And so figure that you're going to get 4 to 5 minutes of their time. And again, I don't know that it matters which country you're in. And so in that 4 to 5 minutes, how can you get 30 to 60 seconds across about this, saying like, hey, I just want to tell you the story. I just want to tell you what I'm working on. I just want you to listen for 1 minute. And so if we go in and think that we're going to try to explain this over a 10 to 15 minute time period, you're going to see the physician's eyes glaze over after 30 to 60 seconds. It's just the nature of how it works. With electronic communication, I think that can be helpful sometimes. And so I think sending a message ahead of the appointment and saying like, hey, I've been researching this and I'm really interested in it. Can we spend 2 minutes while I'm there just talking about it and talking about what this means? And so sometimes getting physicians information ahead of time is helpful. And then I'm chuckling because physicians are very susceptible to flattery. Like you may not know this, but
my dad's a doctor, so
okay. Yeah. And so I mean, studies have shown over time, right? If I'm a pharmaceutical company, I can influence me by like giving me a pen with a pharmaceutical company name. We're not difficult to manipulate like that, and so patients can use that to their advantage. And saying like, gosh, I've been working at this so hard, and you're the one physician who really listens to me and helps me out. Even if that's not necessarily true, physicians respond to that. And
that's a great tip.
A bit of flattery goes a long way in trying to get the attention of people you're working with.
One of the take-home messages, I think, from what you were just saying, though, is for people to recognize what the physician is there for and what the physician may not be capable of doing. So physicians are a wonderful resource for ruling out a major physical abnormality that is causing symptoms. And if you go into your medical journey viewing it that way, I am here to rule out a medical problem that could need medical or surgical treatment. And then at the end, I advise people to say to the physician, okay, so now that we've run all these tests and all these things, do you feel, in your medical opinion, do my test findings explain why I have these chronic symptoms? And frequently, I think, at least from my experience, physicians are relieved to get that question because that gives them license to say, actually, I don't know that this really explains what you're going through. Not to say that the opposite won't occur sometimes too in the vestibular world.
Yeah.
because, so many symptoms can arise from a vestibular problem. But I find physicians, I think, are often, they need permission to tell the client that there may be some kind of mind body or anxiety, as they may call it, anxiety or stress related component. I think physicians do pick up on that. They just don't always feel licensed to say it. But that's just
I think
my thought.
Yeah, no, I think you're accurate on that, and I think that some physicians are more eloquent than that at that than others, and so some
Mhm.
physicians are able to say, like, yes, sometimes we see symptoms and we don't have good explanations for them, and it turns out that oftentimes things that are going on in people's lives can be just as important as what's going on in your body. When it comes out less caring than that, it sounds like what you said, like, well,
Dismissive. Yeah.
yes, get out of my
Yeah.
office, you're faking, you're wasting my time. And I
Yeah.
think that ties into the idea that a lot of physicians sort of learn that their job is to fix things. And so when they can fix things, when they give antibiotics for strep throat, it's very easy, it's very happy. It's one of the reasons I think dermatologists are so happy and so popular. Like, I'm going to pop out this mole and send you on your way,
Fixed.
and all is good. and and so when they can't fix, when physicians can't, they start to get uncomfortable. And if we as patients are in there saying, like, look, I need you to fix it, I need you to fix it, then you set up this dynamic where, like, they don't know how to fix it, they don't really know what to say about that, and so then it gets uncomfortable. But as you said, if you give them the space to know that they don't have to fix it, and then there's a specific role that they can play to help you recognize that it's not an infection, it's not a tumor, it's not a fracture, it's not a broken neck, then that does free them up a lot, I think, to turn that relationship from an adversarial one into a cooperative one, what we're all looking for.
Sure. And it's certainly worth trying, but to be fair as well, that we're giving people the benefit of the doubt, and in the system that we're in and with the training people have, frequently it still won't turn into a cooperative relationship that way. And in that case, my general advice to people is don't listen to people who say that you're broken.
Yes, yes. And I have that conversation with people all the time, and especially pain, but also the dizziness and the other vestibular symptoms. It's, when people say that you're broken and you can't get better, it's a fundamental misunderstanding of human physiology. Like, we are so neuroplastic and we have so much ability to change and to heal in so many different ways, that to say, like, this is the way it is and you better get used to it, it's a fundamental misunderstanding of who human beings are.
I want everyone listening to this interview to rewind and listen to that sentence a few times. So, which is a wonderful segue into another topic I think that you're going to have a lot to say about, because I'd like to know more about what this process looks like. So not just the treatment, but what does recovery even mean? So as people start to recover, you see all these success stories online, and I like to have success stories for people to listen to, but what does this even look like long term for people with chronic dizziness disorders? What does recovery mean? What does it look like?
So it was interesting. I was talking to a patient yesterday who had been diagnosed with cervicogenic dizziness, who's very interested in these ideas. And I think that he's been working hard on this and doing a lot, and has been improving a lot in a variety of ways, but still has some of the symptoms. And so he'd been working on it. I had first met him maybe 6 weeks ago. And I think that he was feeling badly because he wasn't better with everything.
What does that mean? Right.
And so we talked about it for a while, and I normalized that physical symptoms, even when we know where they're coming from and are working hard on it, they gradually improve over time. And so a lot of the success stories out there are people who say, like, yes, I realized this, and I read this book, and I talked to this person, and then I went out and ran a marathon the next day. And I think that's not what it tends to look like for people. That healing tends to go up and down, and there tends to be a process to it. And I recorded 2 podcasts with the Curable app in 2017 and 2019. And especially that 2019 podcast, like I talk about my own experience of having a flare up when I opened this practice, and just very gradual and slow improvement, but within a certain amount of time, to the point where I can play 36 holes of golf if I want, and I can go on a 50-mile bike ride, and can do an hour of power yoga every morning, and I just don't have limitations in my life. Does that mean I never get pain or symptoms? No. And so I'm a human being just like everybody else is. And sometimes things are going to happen in our lives that are too much for us to process just with our brain. And so then our body helps us to do it as well. And so as people move forward, I don't expect that people are never going to have symptoms or never going to need to call me or another physician ever again. What I'm hoping for is that people have a nice framework for what to do when symptoms develop, and then they can recognize that they can be evaluated or not, but that having symptoms doesn't mean that there's damage going on in the body. And once we recognize that, then my hope is that people can have a variety of tools and a variety of strategies so that they can get those symptoms to calm down quite quickly, so that they get on with the important part of living their life.
And this is where the way that this is explained to people matters so much, because people with Malte-Debarkman syndrome, they'll talk about remission, which already implies a lifelong neurological problem that sometimes you get breaks from, right?
Yep.
And with triple PD, they'll talk about relapses. Oh, I had it and now I have it again. But what you're describing is how, and we talked about this earlier as well, it's normal to have unpleasant sensations. I've never felt 100% every day of the week. It just doesn't happen. But the framework in my mind is, oh, yeah, today I'm being affected by whatever's bothering me, whether it's stress related or what have you. And I don't have that word in my head. I don't have the word relapse. I don't have the word remission in my head. And so the danger signal, it comes up. It's not pleasant to have pain. My personal mind-body symptoms are migraines, digestive issues, and back pain. So that's how mine show up. But I just say, oh, yeah, I'm a human being who's being affected by something, and here's my body telling me about it, and that's it. There's no meaning to it, so it just doesn't stay. But what you're describing here is the way that you're framing this is that it's completely natural to have those ups and downs and have this take a while and be a slow process of growth, and that is normal. That is what recovery looks like.
Yeah. And I think, a couple of thoughts about that my patients who learn not to be afraid of symptoms are the ones who do the best. And so even if the symptoms are significant, if they can be confident that they're fundamentally okay, and a lot of them have seen a lot of physicians and had a lot of tests, and so they tend to know that, then they can work with those symptoms and work their way out of it fairly quickly. And so, even in my own life, like I said, and like you said, it's not that we feel 100% every day. There are times where things are going on and we can feel it in our bodies. And I think that's natural. Over Christmas break, I come from a long line of golfers and have now passed that down to my 15-year-old son. And so we went down south and played golf for a few days. And I sort of like tweaked something in my back on the way in the couple of days leading up to that. And it was interesting. Like, I do this for a living. I'm Dr. Stracks. Like, I know these things. And then this thoughts keep coming in like, oh my goodness, it's like this. Am I never going to play golf again? And what probably is more likely is that my 15-year-old is now starting to be better than me. And pressure to try to stay ahead of him. But even me, right? Those thoughts start to creep back in like, oh no, something's really wrong this time. And, we went down there, we got caught in the Southwest Airlines mess. And so we ended up driving instead of flying. But, we played golf, we had a good time. Like, we drove back up here.
I'm very sorry about the Southwest Airlines thing. I caught that. Oh my gosh.
Got our suitcases back after a week. And so all is
goodness.
Yeah.
So this is just normal life. This is human life. And again, I very much understand, and I'm sure you do, the distress and the despair people feel when they're being told, "Oh, it's a lifelong condition." But it is a lifelong condition to be human and have physical symptoms show up in our bodies, but that doesn't mean you have a syndrome. It doesn't mean you have a disorder. It's just part of the human experience.
Yeah, and I think that, practitioners and physicians have known that since the beginning of time, right? You look back at the writings of Aristotle and early European physicians, and they wrote about this. They knew that what was going on in people's lives was part of what was showing up in their bodies. It's just in the past, say, 50 to 75 years that the medical system seems to have forgotten that. And that's partly the training, partly the influence, I think, of the pharmaceutical industry, and then medicine as a business and really pushing out the ability to sit and talk with people. And so the goal becomes to try to make the correct diagnosis and prescribe the right treatment. One of my colleagues has a story that he actually wrote the book on it, like literally wrote the book on integrative medicine. But before he was interested in integrative medicine, he was a small town physician in rural Idaho, and he said a woman came into his office several times with terrible buttock pain, like she just couldn't make it better, and he tried everything and ran it for tests, all the things that we do as physicians. And again, this was sort of before he really was interested in integrative medicine. He made the decision that the next time she came in, he was just going to talk with her. And so he said that he came into the room, he took off his stethoscope, he put his phone to the side and said, "Just tell me what's going on in your life." And she said, "Gosh, Dr. Dave, I just got to tell you that my husband retired 6 months ago and he's around all the time. He's just the biggest pain in my butt."
Yes. Yep.
Right. And so if we give people space, like as physicians and practitioners, like they will give us the answer. I was in a staff meeting at the hospital one time. We were talking about these concepts, and I said how I had made a pledge to myself when I first got to medical school, right? It's 20 years ago, that if somebody had back pain, I would always ask them what was going on in their lives. And my colleague said, "Well, like, what if somebody comes in with a sinus infection? Do you ever ask them what's going on in their lives if they have a sinus infection?" And I was like, "No, I usually just write antibiotics, but I'll do that." And so we had to take like 5 or 6 shifts in the urgent care centers on weekends when I was at the hospital. So I was doing an urgent care center shift, and somebody came in with sinus infection, and so I wrote the prescription for antibiotics and said, like, "Hey, anything stressful going on?" And they started telling me, like, it was a couple, and he had just lost his job, and they were worried about it, and what was going to happen next. And I swear we had a 2-minute conversation about it. 2 minutes, 120 seconds. And so it got up to go, and they just started talking about like how wonderful it was to talk to a physician and somebody who cared so much. And I walked them down the hallway, and they kept talking about how wonderful it was. And I told people at the front desk, "Oh my goodness, I can't believe that." He said, like, 2 minutes. And it's just like, that's what it takes. But I say this all the time in lots of different contexts. The difference between 2 minutes, and 0 minutes is huge. And so if we don't take that time out to just say, "Hello, how are you? I'm sorry you're not feeling well. Tell me about it," then we get into a situation where people just get shuffled from practitioner, and the underlying issues never get discussed.
Well, it's a system that also unfortunately rewards that. And this pains me. So, because people send me research articles, "Hey, Yonit, did you see this latest one on triple PD? These biomarkers, there are brain changes. This is the cause." You just described the problem. It's like me saying my hand hurts and I have hurting hand syndrome, and that's my diagnosis. So, again, it's unfortunately not to say that it's all bad news, everyone. Obviously, there are incredible research projects going on. Dr. Schubiner is involved in one of them, the EAET study
Yep.
for fibromyalgia. There are many studies like this going on now, but it's like pulling teeth to get funding for those kinds of studies. Whereas, oh, I have this brand new lab test that's going to show you definitively if someone has one of these conditions. That's what gets the funding. That's what gets the momentum. That can get people in and out the door a lot more quickly. So unfortunately, you and I both work with people who are the, again, no one's trying to victimize anyone, but these folks are victims of that mentality, of that system.
Absolutely. And it, like I said, there's a lot of different pressures in a lot of different directions to treat biomedically, to do procedures, and certainly that in your field. And I say this fairly regularly, like none of us, I don't think, would have, if we were starting from scratch, set up the health system the way that it is. Like I don't know that anybody would say,
No one would have.
yeah, here's a great idea, 2-minute visits. Like that's
Right. Right.
better. And yet sort of that's the way it's been pushed over time for a whole variety of reasons. And that's the system we have to work with. And so, as you say, it's, you and I and Dr. Schubiner and others, we've managed to put ourselves in places where we have time to talk with people and hear their stories and get to know them and find out what's going on. And if we do that, if we can elicit some of the story and not be judgmental and be empathic, that goes for a lot.
Well, I'm curious to know what your thoughts are on why that is. So, again, many of the people that I help, I'm not working with as individuals. They're just watching my YouTube videos, and they'll leave a comment, and I'll say, "Yeah, that makes sense with neural circuit dizziness." But they're still, again, in many cases, able to recover. However, some people need that. Now, why do you think that is? Why do some people need a practitioner to help?
I mean, everybody's different, right? And that's one of the things I love about practicing medicine is that everybody's different and everybody's got their own story. And so some of it, I think, is people's background. And you mentioned Dr. Schubiner's EAET study. And so I worked with him when I was a resident on the very first fibromyalgia pilot study. And we, and then we, from there, branched out. We were going to do a different study. And so we worked with a rheumatologist who had a fibromyalgia clinic. And I was in charge of doing the intake with the fibromyalgia patients. And it included a structured interview on history of trauma. And so I went and I started asking these questions, and these patients in the fibromyalgia clinic went on and on and on and on and on about their experience of trauma over the course of their life, so much so that I got overwhelmed and didn't know what to do with the data. We never published that particular study, but it always stays in my mind. And so whether it's fibromyalgia or other chronic diseases, there's always the possibility of significant trauma in somebody's life. And I think the more of that, the more likely people are to need a lot of patience and a lot of kindness and a lot of guidance in the process of getting better. Some people just by their nature, I think, are more prone to want a expert to say like, hey, I think you need to do this, or I think you need to do that. And so some people, and my experience when I was young and I had been a college athlete, and so I had a lot of confidence in my body. And so once I recognized what was going on, I felt like I could move forward without a professional opinion on it. Although for a long time, when I told the story publicly, I'd say like, oh, I read Dr. Sarno's book and I went out and I got on my bike and I did I went on this bike ride and I got better. But in truth, like it took several months after that. And I still have the journal that I kept. It's probably in the bookshelf behind me. But for months, I would write like, how is this really right? Nobody's really examined me. Should I get a practitioner? And so I just think by nature, some people are more comfortable in hearing this and being able to enact that to help themselves move forward. And some people, I think, are more comfortable having a professional say, like, A, I think you're okay to do this. That's one of the things I'm always trying to do when I'm evaluating somebody. And then B, here are the things, here's where I would focus my attention if I were trying to move forward.
Okay. So you frame that in a very, a cognitively oriented way, which I think is really the way I explain a lot of things on my channel, because everyone can hear it and understand. But something else you're saying here reminds me of something you said just a few minutes ago. So you mentioned people with trauma, and you've also mentioned a few minutes ago that symptoms show up in our bodies. And I'm wondering if you can explain a little bit more about why people who have had histories of difficult life experiences, perhaps not things that people would classify as trauma, but difficult life experiences, are more likely to have physical symptoms later on?
I think that it goes back to what we were talking about at the beginning. And so the conventional medical system, when I was in medical school, I was taught that if somebody had a symptom, something was wrong in the body, there was damage. And
Mhm.
that's an intuitive way of understanding physical symptoms. There must be something wrong in our bodies. But the research doesn't really show that. The research
Mhm.
says that people can have a lot of symptoms without any damage, and interestingly, a lot of damage without symptoms as well.
They absolutely.
and
Yes.
and so it's not that that's not why we get symptoms. More likely we get symptoms because our brain is registering potential danger, not just in our body but in our lives. And pain and symptoms are a potential brain response to danger.
Danger.
And
Yeah.
so one of the ways I talk to people about this is that when we get in danger, so say you walk into a unsafe situation and there's a gang there and you're being threatened, right? There's lots of different things that we can do to try to work our way out of that. We can try to bargain with them. We can get on our phone and call 911. We can get a lot of blood flow to our big muscles and we can run away. We can try to fight back. And so a lot of different levers our brain can pull.
Mhm.
But in certain situations, it makes the most sense to pull the pain lever and create pain or symptoms or dizziness or nausea or any of those symptoms. There's a whole variety of reasons that those symptoms will develop in response to this sense of danger that our brain notices.
Mhm.
And so people who grow up in difficult circumstances, stressful circumstances, abusive circumstances, their brains have experienced a lot of danger over the years. And if the situation is stressful enough, it's appropriate to assume that the situation is going to be dangerous because often enough that it is.
Mhm.
And it's better to assume that it's danger and find out that it's not than to assume that it's safe and then find out it's dangerous. And kids are smart and savvy about these things. And so they don't need to have bad experiences very often for them to recognize that it's best to see the danger if there's any chance that it's present. And so
Mhm.
people who grow up in those environments, once they're adults, their brains are very attuned to the possibility of danger.
Mhm.
And if lots of different situations look dangerous, there's more opportunity for our brains to say, like, okay, pain and symptoms are a good way of dealing with this particular situation at this particular time. And so I think
Mhm.
that's why people who have high ACE scores, adverse childhood event scores, or have grown up with a lot of stress can be more prone to chronic symptoms
Mhm.
as they get older.
Mhm. Which raises another important question. Can that be, I guess, I don't wanna say undone because we can't change the facts of our lives, but can that hypervigilance be reversed?
Yeah, I think that studies have shown that absolutely. And,
Mhm.
those of, people who are watching who've read Bessel van der Kolk's book, The Body Keeps a Score, about all the resiliency that can happen in people who've experienced trauma. There's a book I like called Upside, which is the new science of post-traumatic growth. And so you interview people who've experienced trauma, and over half of them feel like it's led them to a better place than when they started. And the what they've been able to research about how people experience this post-traumatic growth, it looks very much like what we talk about for healing chronic symptoms, having connection with community, connection with professional practitioners, connection with a higher power, doing the journal writing, telling the story, speaking truths. All of those are helpful.
Accepting your emotions.
Accepting and expressing emotions,
Mhm.
give yourself permission to have them. Absolutely. That
Mhm.
those are both ways that people move through chronic symptoms and that people move through this history of trauma. And so there are so many examples out there of people who've
Mhm.
grown up in difficult circumstances and have found their way through these through the hypervigilance and through the difficulty and trauma to lead great, wonderful, productive, fantastic lives. And so absolutely, I believe in the power of the human body to heal and the human spirit.
Mm. Yeah, well, it makes you when you describe it that way, it makes you wonder if essentially we're doing both things by addressing mind-body disorders. And I've always found, well, the more I do this work, really, the more I find this dichotomy between the mind and the body to be less and less relevant, that you can't really treat one without treating the other. You can't they're one system. They're connected 100% of the time. So whether someone's had traumatic experiences or doesn't specify traumatic experiences or recall stressful experiences that were involved, this post symptom growth or post traumatic growth, they're the same process essentially.
Right. And I've heard that from people over and over and over the years that they don't want the symptoms, but they also wouldn't trade the experience because the symptoms have pushed them into a place that they wouldn't have been able to go to otherwise. And so sometimes I'll say to people that I think our body at some point says, like, the status quo is no longer an option. And so we get sick or we get symptoms, and it's pushing us to go to a different place. And different places can be professionally and relationally, and how we interact with ourselves and how perfectionistic we are and self-critical and all the rest. But that if we still have symptoms, it's because we haven't gotten to where we need to go. And our body is giving us feedback about how we're doing and what we need to work on. And if the symptoms are still present, there's still work to be done to get to this place.
What a hopeful message, though. And this is one reason I take the approach you do. I hear this too much, in a good way, from people who have recovered. I wouldn't trade this experience in. As awful as it was, I would never want to do it again. I wouldn't wish it on my worst enemy.
Yep.
I'm a different person. I've grown so much from it.
Yeah.
And I feel that there are so many methods out there, neuroplasticity programs, for example, that can help you overcome your fear of the symptoms and ultimately, in many cases, knock them out. And all power to people who want to do that. Again, I'm not judging anyone who chooses whatever method's working to help with symptoms. But when we view the symptoms with this laser focused, I'm going to program this out of my brain, we lose this opportunity for growth. There's a reason we have symptoms. There's a reason the brain was in that state. It was susceptible to it. There's a reason. So let's learn what we can and make sure we're not susceptible in that way in the future.
Yeah. I mean, I say to people all the time, right? The symptoms are not the enemy. And I was talking to a patient the other day and said that she was a college student. And I said, say you got a bad grade and the male person came and delivered your grades and you were disappointed with one of them. Would it be smart to get mad at the male person? That's not where the action is. And so the symptoms are giving us messages, and the symptoms are trying to convey something to them. And once we can recognize that everybody's on the same page, everybody's working together, our body's not trying to sabotage us or make our lives miserable, then we can interact with these symptoms in a much different way, and we can learn from them, and we can grow from them, and we can get to the amazing places that we all need to go.
Wonderful. So I know our time here is coming to an end, but before you go, I'm wondering if you have any practical tips to share with people who are dealing with chronic dizziness right now. Many of the people who watch my channel understand. They've seen a lot of my content and they understand where it's coming from, but some of them are still struggling with that frustration and those ups and downs, and they're wondering, am I going to be the exception? Am I going to be the one who never gets better? So I'm wondering if you have any advice for them.
I think it's, if we say that 95% of people get better, I don't know what the numbers are, but everybody thinks that they're in the 5%.
Right. It doesn't matter what the statistics say,
Exactly,
right?
Exactly. Everybody worries about that. I think it's a two-part process. One is understanding what's going on. So as long as we're locked into this idea that something is wrong in our bodies, then we're kind of locked into physically based treatments. And so understanding that we can feel very, very sick, even though our bodies are healthy, is the first step. And then using the symptoms to try to point to what needs taken care of. Do we need to be kinder to ourselves? Do we need to be less perfectionistic? Is there a relational issue that we need to work out? Is there a workplace issue that we need to work out? Understanding that the symptoms are not there on accident and the symptoms are not there randomly, but we're human beings. So we're responding to what's going on in our lives and trying to use that to understand what we need to work on and what we need to do in order to move forward. And there's a lot of resources, and in your world and my world and other places on the web. And so even if people can't get to practitioners who understand this, or even if people are in different countries and don't have access to us, there's still a lot that can be done that helps people to move forward. And it can take a while. I have worked with people. I did a recording during pandemic of a patient of mine who had terrible foot pain, and she got better like 2% a month for about 5 years. And that's how she got better. And she coined a new term called 2%ers, of people who just slowly and steadily move towards being healthy. And so even if people are working hard on it and feeling like you're not getting where you need to go, it can take a while, and there can be ups and downs to it, and it never goes away all at once. It's much more like learning a new skill than it is just having something happen right away. And so sticking with it and understanding that, yes, it can be frustrating, but that healing is possible for all of us.
For all of us, including people with dizziness disorders. It's not just pain. It's not just pain, and we see it. You and I both see it in our practices, just how debilitating it is. And if we could rush that process for people, we would. I tell people, if I find the secret, I will release one final video and then I'll go do something else. It'll be fine. I'll tell you about it first. But there isn't a shortcut to growth. There just isn't.
There isn't. And, I was talking to one of our psychotherapists about this yesterday. She'd been working with somebody who'd had sort of chronic head symptoms and derealization symptoms for a while. And they worked on it for about 15, 18 months. And we were talking about, like, is there anything that he or she or I could have done to speed up that process? But we feel like it happened at the rate that it needed to happen for him. And that, as you said, like, we can't rush growth. And that's just the nature of being a human being in the 21st century.
Yeah. Well, thank you so much. Those are, I think, are very wise words to people who are struggling. And I'd love for you to share how people can get in touch with you to work with you if they're interested. I know you said you work via telehealth as well, so not just with people in your area.
Yep, we're via telehealth. We're licensed in Florida and several other states around the country. Dr. Schubert is joining us. You can go to our website, cormendyhealth.com.
And I'll link to it in the description.
Yep. And people can read information on my blog, johnstracksmd.com, as well. And either of those, you can send a message to our staff and they'll reach out and get you all set. Okay.
Thank you so much. I just on behalf of everyone who watches my channel and who needs to hear this from as many people as possible, thank you so much for sharing your experiences and the hope that people are going to feel after hearing this interview. So thank you so much.
You're welcome. Delightful to be here and talk with you. And I am always up for sharing information about what I know can be so helpful.
Awesome. Well, thank you so much, Dr. Stracks. Have a good one.